The family of a woman who died after being misdiagnosed by a physician associate has won the backing of the BMA in a legal fight for better regulation. Emily Chesterton's blood clot was missed by a physician associate who she had believed was a GP. Now, PAs, as they're widely known, are medically trained, but they're not qualified doctors, and they are increasingly being relied upon by hard-pressed NHS services. Emily's family is now taking action against the regulator, the General Medical Council, and is calling for better clarity over what PAs should and shouldn't do, as our health correspondent Rebecca Barry reports.
Good morning.
Good morning.
My name's Rue, one of the physician associates here. How are you?
Rahel is not a doctor, but has done 2 years of postgraduate medical training. He's one of more than 40 physician associates working at this hospital in Reading.
Do that one more time.
Where they're seen as a vital part of the team, supporting doctors to care for patients. But elsewhere, there's a growing debate about their role in the NHS.
If I'd known that she had seen a PA and not a doctor, I would have taken her straight to A&E, and we were told at the inquest that had we done that, she would have lived.
Marion and Brendan Chesterton are bringing legal action against the medical regulator, the GMC. Their daughter, Emily, died of a blood clot in her lung after she was misdiagnosed by a physician associate she thought was a GP. They accuse the GMC of failing to distinguish between the role of doctors and non-doctors.
We're just trying our best for Emily. I just want to help other people and get something good out of this, because she was such a beautiful person. She'd want this. She wouldn't want anyone to go through what we have been through. She's lost her life, and she had such a wonderful life ahead of her.
ITV News has learnt the BMA is financially supporting their legal case, calling for a clear set of rules for PAs.
The limits to what they can and can't do is something that's been set locally, and what we're seeing is physicians associates being placed in situations which are unsafe for them and unsafe for patients.
So we have a new patient in bed,
Back in Reading, Rahel works under the supervision of a doctor, as all PAs should, taking medical histories, helping to diagnose.
There are more than 3,000 physician associates and anaesthesia associates working in the NHS, but there are plans to increase that to 10,000 in the coming years. Some fear that's a cut-price way of plugging the staffing crisis in the NHS. Others say it's essential for the smooth running of our hospitals and GP surgeries.
And these bright, young, enthusiastic individuals went to university to learn their trade, just as I did as a doctor, properly supervised, properly nurtured. They really are a welcome addition to the team.
The GMC will begin regulating the profession from December. It says that will be a vital step towards strengthening both patient safety and public trust, and echoes the Department of Health's response that they should be supporting, not replacing doctors. Rebecca Barry, ITV News.